Welcome back to the News 12 Connecticut Education Notebook. I'm Amelie Wilson. Many kids are misdiagnosed with learning disabilities or behavioral difficulties, which can lead to over-medicating. However, Center in Westport is taking an alternative approach to treatment. Anthony Silver is a therapist and board-certified neurotherapist. He's also the director of Gray Matters in Westport, where they work with children who have ADHD and spectrum disorders. Thanks again for coming, Anthony.
My pleasure. Thank you.
So first of all, you've got a student not doing well in school. They come to you. How can you help them?
I think the first thing to do is to identify or to remove some potential issues. For example, I always ask, how the child is sleeping, what their appetite's like. You have to look at the family structure as a whole, and make sure that there are no other issues going on. Frequently, the children are diagnosed with ADHD when they could actually have anxiety or other issues going on. So,
like their parents could be going through a divorce.
Exactly. There could be all sorts of stress in the family which you have to eliminate before you really identify the problem as ADHD.
How many kids do you think are misdiagnosed with that each year?
With the kids that I see, I would think roughly half don't have what I would call classical ADHD.
Okay.
I see a lot of anxiety, and I see quite a few families where the structure of the family is just a little dysfunctional, where the roles aren't as delineated as they should be, and it causes behavioral difficulties instead.
Right. So then you've diagnosed what the problem is. How do you move on from there without pumping a child who has ADHD up with Ritalin?
I guess the best way to explain it is the traditional way of looking at the brain is chemical. So we give children medication to change the chemical nature of the brain. But the brain is chemical and electrical. And if you can change the electrical nature of the brain, that changes the functional state without having to use medication.
And when you say electrical, I'm thinking of a child sitting there with a bunch of things on their heads. How does it work? Your brain produces electricity as it functions daily. If you're tuned out, then you have more of these slow brain waves in your frontal lobes. As you become more engaged in whatever activity you're doing, more alert, you have faster brain waves. So children with ADHD have more of the slow brain waves in their frontal lobes. So what we do is we train them to increase the fast wave activity and decrease the slow wave activity, and the symptoms of ADHD disappear completely. How long does it take to train?
It varies according to the severity of the problem. But normally between 3 and 4 months. With spectrum disorders, it can take quite a lot longer.
Is this something that could be covered by insurance?
Generally it's not,
okay.
Which is a problem.
Right. Well, I'm sure you all are working to hopefully change that. Now, what ages do you usually treat patients? The youngest is 5, I think, that I'm working with right now. And I treat people up to their 60s. So there's no limit. No, I mean it's not just school either. If you can't focus at work, or just even having a conversation at a cocktail party, this could help, right?
That's right. I think there's huge potential in my field for geriatrics, with people who are suffering from cognitive decline, which is natural, to just keep the brain active in the same way that people do Sudoku and crosswords or bridge or any other mentally active game. Neurofeedback could be used to stimulate the brain in the same way.
Is everything done in your office in Westport, or do you have to do it in a hospital setting?
No, it's interesting. With the program that we use, children take systems home. So we have these little portable EEG machines that we program for each child according to what their brainwaves look like. And they take the system home, and it's linked to a PlayStation, a regular PlayStation, with a special controller. So the way it works is that as children concentrate more, which is what you're training them to do to help with ADHD, the car in the game goes faster. So they have a brain-powered PS2, essentially.
Wow, so they've got the controls.
They've got the controls, and they take the system home. Normally I see them every 2 weeks, and they have 14 sessions recorded on this little portable machine when they come back.
and we chart their progress. We chart how their brain is changing over time, which is great.
Fascinating.
It's very cool.
Anthony, if people would like more information, we're going to send them to your website. You're at 181 Post Road West in Westport, or call that phone number on your screen. Thank you so much. Doing a very good work and helping out a lot of confused parents and troubled kids. So thanks again.
Thank you very much.
Well, coming up next, you've gotten your kids through high school. Now they're off to college. How to teach them how to budget, save, and stay out of debt. What every parent needs to know next.